Hello, everybody. This is Dr. Bob and Dr. Kaysen DeMaria, and we are so excited about tonight because we're going to talk about Dr. Bob's guide to a healthy marriage. We're going to talk about the thyroid gland tonight.
Yes.
You know, we always get so much traction when it comes to the thyroid gland, and it's a very important gland. So Dr. Kaysen and I are going to talk back and forth with each other. You know, this happens to be our model right here, just for you to see the thyroid, because people always ask us, don't you just love this model that we have? This is where the thyroid gland is at. So just as FYI, it's here in your throat.
Right here.
And sometimes it gets big. You can feel nodules. People are always asking us to feel the thyroid gland. So let's talk, Dr. Kaysen.
Okay, how does your thyroid affect your marriage?
Well, it affects it so many different ways. Number one, common body signals for a low thyroid: cold hands, cold feet. So did you ever have anybody touch you? Oh, don't touch me, they're cold. So you have cold hands and cold feet, number one, but people are tired. Some of you go to bed tired, you wake up tired, you're depressed, you have fatigue. You know what else is a common body signal with low thyroid? Waking up with a headache in the morning. And we know what happens if somebody has a headache, huh, Dr. Kaysen?
I'm just laughing because if you're just tuning in right now, you're going to have to go and follow us on our other social media platforms because we have some really fun pictures and different things that happen, especially throughout this month with thyroid function, and it's all connected.
You know, it's kind of funny. You have to watch some of the ones that Debbie did, you know, when she was typing with the cold hands and cold feet, and she's doing this with her hands. But how the thyroid affects your marriage. Cold hands, cold feet. And you know what else? Depression. I've read statistics that anybody that's in a psychiatrist's office or has issues with depression, which is very common, by the way, 30% or 20% of the people, 30 million Americans right now are depressed. So how it impacts your marriage is it's not easy to be married to someone who's depressed. People who have low thyroid are also constipated. So how would you like to hang out with someone that's depressed, tired, constipated, and cold hands, and you want to be intimate? It's not going to happen, is it?
I don't think so. Okay, moving on. We always highlight the thyroid in January. Have you seen anything new or different in the past that you can share with our viewers tonight?
You know, I think especially in the office, so many people are iodine deficient. And I mentioned this to someone the other day. You know, I said, so many people have low thyroid. So I asked them some silly questions.ดyou brush your teeth today? And they look at you like, yeah. Did you take a shower in the last 24 to 48 hours? Like, do I like smell? And then you sit in a hot tub or do you swim? And especially for our patients that live in Florida, and for those of you who are tuning in Southwest Florida, you know, we go back and forth.
Give us some love.
Yeah, give us some love. You know, all of the people from around the world. But you can come and visit us in our Florida practice. And I know that Dr. Kaysen and Dr. Anthony are going to be getting their Florida license here pretty soon, so we're going to have a lot of fun. But people are in the pool. And see, when you brush your teeth with fluoride toothpaste, when you take a shower and don't have a shower dechlorinator, and then if you're in a pool or a hot tub, that takes iodine out of your body. And I talk about that in Dr. Bob's Guide to Prevent Surgery. I have a whole chapter just on iodine. Iodine deficiency is the modern day scurvy. Just briefly, between 1750 and 1850, and you want to pass this on, between 1750 and 1850, half the transoceanic voyagers that left London never came back. And you know what they died of? Scurvy. Scurvy is lack of vitamin C. The modern day scurvy is lack of iodine. Not only do we not have enough iodine in our diet, but we took a shower, we brush our teeth. Now, we sell toothpaste that doesn't have fluoride in it. We have shower dechlorinators. So our goal is to minimize chlorine, bromine, and fluorine. So we learned that. It's exciting, isn't it?
And you know what? Also, we have members in our office, and you watching, you might enjoy going to the pool and working out. I have some of our Ohio members, you know, they're doing water aerobics and different things, especially in these cooler months. And you could, at home, know someone or yourself have a cyst on your breast, also on your ovaries, and these are a lot of times lack of iodine, and especially with the breast thermography service, which we're doing in our office now, what we're finding is if you have any kind of changes in symmetry in your breast, that could be due to lack of iodine. And that's why right here we use liquid iodine, which is from Biotics, and we use this in our practice depending on what's going on in the body. But for ladies, you could do 1 to 2 drops on each breast as a preventative measure to keep your breasts healthy, especially if you're brushing your teeth, you're taking a shower, baths, and you're swimming.
Well, you know, it's kind of interesting because I had someone today that I was having some conversation with, and she could not believe how much her breasts changed by putting liquid iodine on them.
What do you mean by that?
Well, she had a thermography.
Yeah.
And when we did the thermography, I made that recommendation that she apply clear liquid iodine. We don't want you to be painting brown iodine on your breasts. Anyways, and we don't want any Instagrams on that either. But here's what's going on. Your thyroid gland needs iodine. Your breast use iodine. Your ovaries use iodine. I take iodine because of my prostate gland. So those glands need iodine. So we talk about all this because we are puzzle solvers. And we have learned that iodine deficiency is a very common challenge with breasts. So let's say that you're a lady and you have cysts on your breast. You know, you're not going to want to be intimate if you have tender, sore breasts. So you could have a low thyroid, cold hands, cold feet, white space teeth, can't go to the bathroom, and it's all interrelated with each other.
And you want to lose weight.
Yeah, I got it. Everybody wants to lose weight.
Okay, on to the next one. If you have had your thyroid removed, what is the best way to stay healthy?
Well, you know, that is a very, very interesting question. And the bottom line is you're going to need to be on some kind of medication forever and ever. And I've seen more and more people, especially in my Florida practice, that have had their thyroids removed. And what we're seeing is a lot of these individuals have a parasite issue. And they travel a lot. And it's just a real common problem today. So just because you have a nodule on your thyroid gland does not mean your thyroid gland has to be removed. We've had practice members that have come in that we've adjusted them, just do spinal adjustments, allowing the brain to send the message to the thyroid gland, and their nodules have gone away. That's pretty cool, you know. I know.
And also with women in our practice, especially with us being certified in pediatrics and pregnancy, you could have challenges getting pregnant or staying pregnant if your thyroid isn't at 100%. So we've had so many stories of women that they've had IVF or all these different drugs to try to get pregnant, and once we start working with the nervous system and working with the brain and the body and the pelvic rotation and then assessing thyroid function, whether it's a urine iodine test or a thyroid panel, and by supporting that, guess what happens?
Bam.
They share with us, we got pregnant.
I know, that's the bam. You know, I want to talk about this for a moment. So a low thyroid gland, subpar thyroid, could result in elevated cholesterol. And when you have elevated cholesterol, they want to put someone on a statin drug. One of the side effects of statin drugs is the inability to obtain, maintain, and sustain an erection because of a possible low thyroid issue. It's kind of fun that we learn all this stuff, isn't it?
I'm glad we didn't miss class that day.
I never missed one class when I was going to college, ever.
Okay. Next thing, breast thermography, and how does the thyroid relate to breast health?
I think we kind of alluded to that because your thyroid gland needs iodine. Now, I'm not saying this to be silly because sometimes it's like so far out. If you happen to be a larger breasted woman, you really need more iodine than someone maybe is not as large breasted because your breast tissue needs iodine. You say, well, how do I know, Dr. Bob? Well, you could do what we call a urine iodine loading test. And how that test, simply put, is that for 4 days you take no products at all. And then you do a pre-test, but that means you urinate in a container. You take 50 milligrams of iodine, which we'd provide for you, and you catch your urine the next 24 hours. And if your body is holding on to, let's say you should excrete out 95% of the iodine you took in, but let's say you excrete out, let's say 35%, that means your body's holding on to iodine. So this is not a thyroid class, but what I want you to see is your T4, your thyroid, inactive thyroid hormone, should be about an 8. And if it is less than 8, it's possible you don't have enough iodine. But it's cold hands, cold feet, white space teeth, depression, constipation, morning headache, depression.
And going back to breast health, what I'm really excited to be able to offer is a preventative measure to help you save your breast tissue and create a strategy for overall health.
So right about there is what the cyst looks like. And
here you can see.
So you know what's kind of interesting with the breast thermography, and Dr. Kaysen has just been trained, and she's doing them in our office, and Debbie's doing them in our Florida office, is this. There's patterns. We see patterns. We don't see cysts, but breast thermography is a measure of function. Mammograms are structure. A thermography will tell you 5 to 8 years before it even shows up on the mammo.
And I can share with you, we do have a couple spots still available on Friday, and it only takes a couple moments to do, and I love it as far as with just no compression, non-invasive, no radiation. We're not touching you in any way. It's very easy.
And it takes a moment or two.
Yes.
I know that we have some bread here. I just have to talk about bread just for a moment. Because, last thought before we sign off. So there's something called a TPO. You may have heard of a condition called Hashimoto's. It's an autoimmune problem. So one of the most common challenges with Hashimoto's is a lot of times it's caused by eating gluten. So one last thought before we really sign off, and then if you have any more questions, Dr. Kaysen, this is a thermometer. You say, what are you going to do with that, Dr. Bob? It's really easy. This is not a real thermometer. This is from my old x-ray developing in the tank a long time ago. You get your thermometer and you put it in your armpit when you first wake up in the morning. The temperature should be 97.8 or below. But 97.8, but you want it at that number. If it's below 97.8, I correct what I'm saying, it should be 97.8, you may have subpar thyroid function. So we know that thyroid is important for marriage. We know that your thyroid has a lot to do with it. If you have cold hands and cold feet, or if you're on levothyroxine or anything else, we don't have a license to take you off those meds, but we can teach you and we can work together, right? And you could be anywhere in the world and come and visit us, because we have people that do visit us. And then what are we doing next week in our half hour of health? This is always exciting too.
So next week is a workshop you don't want to miss. It's going to be in our Westlake office on Wednesday at noon and Thursday at 6, and we're talking about how to prevent cancer.
And we have some very interesting insight. So I'm not sure if you gave us any love. Give us some hearts and some thumbs up so we can pass this around the world. We'll definitely be posting this. Pass it on. We want people to get married and stay married and have lots of babies. See you next time.